Degenerative disc disease. Now, what is it and how do we treat it? Well, in the next 90 seconds, we're going to get down to the bottom of it. So I want to start off with, what is degenerative disc disease? Well, you see, your spinal disc are little cushions that are in between the bones. And inside of this cushion is a fluid-filled jelly that allows your disc to be bendable and movable. Well, over time, due to dehydration and poor movement, if these discs start to dry out, they become dry and brittle. And then your spine starts to become very stiff. As that happens, it's kind of like a dry sponge, and that disc can start to wear out over time. As the disc becomes dry and brittle and your spine can't bend, muscles and these things called ligaments have to bear more stress. Now these areas, you can see how this disc right here, once it starts to wear away, these bones can develop osteoarthritis and these bone spurs. Now that can lead to pinching of these nerves, it can lead to muscle spasms, and there are certain areas that can lead to instability. And that instability is what causes your body to try to warn itself by shooting sharp shooting pains down your legs or muscle spasms in your back. Now, degenerative disc disease can be worked on. It can't be completely cured, but you can do a lot of things to help it. So if it's just a matter of having dry disc, then making some dietary changes and also doing things like spinal decompression to take pressure off of that disc and allow fluid to get back into the disc and hydrate it, similar to taking a dry sponge and running it under a sink. This helps a lot with your mobility and flexibility. The second thing is if you have some ligament damage and some instability going on in your spine, then there are ways to tighten up those ligaments with different sports medicine injections. Once you get those ligaments stable, you're not going to have as much excessive movement, muscle spasms go away, and you get out of pain.